Good day. I am Marites Tiongco, and I'm here to present our paper on investigating the impact of conditional cash transfer on adolescent pregnancy, incidence, and health outcomes. With me are my co-authors, Dr. Mitzie, Irene, Conchada, and Ms. Dominique Hannah C. One interesting area of research is the educational aspect of the conditional cash transfer. But before I tell you about the education and the CCT link, let me tell you about some situational background on teenage pregnancy in the Philippines. According to the Philippine Statistics Authority, the total fertility rates have decreased. But what is alarming is the number of adolescent pregnancy or childbearing of the 15 to 19 age group. Citing the Philippine PSA report, adolescent birth rates were 47 per 1,000 in the 2017 National Demographic Health Survey. The Philippine Development Plan is aiming for a rate of 37 per 1,000, while the Population Commission targets a 50% reduction from the baseline of 57% in the 2013 National Demographic Health Survey to 28% by this year, 2022. There was a significant decline by 30% in 2020 at 31 per 1,000 girls, which might increase during the COVID-19 pandemic. And in terms of aggregate lifetime earning potential, the Population Commission chief referenced a 2016 research by Dr. Alejandro Herin on education, earnings, and health effects of teenage pregnancy in the Philippines, which mentioned that childbearing, aside from associated health risks, has implications in opportunities lost for their total development and well-being. And young Filipinos will not be able to fulfill their full potential, and the country will risk missing a demographic dividend. Now, there's also the implication on education of out-of-school children and youth. According to the annual poverty indicator survey, 13.8% of young women left school in 2016 compared to only 5.9% of young men. The three main reasons identified in this survey were lack of personal interest, insufficient family income, and marriage and family matters. So teenage pregnancy is one of the reasons of the high rate of school dropout for adolescent girls, as well as family matters. A UNFPA commissioned study in 2016 revealed that those adolescents in the Philippines who have begun childbearing before the age of 18 are less likely to complete secondary education compared to the adolescents who have not begun childbearing. The non-completion of secondary education impacts employment opportunities in the future and total life earnings of families. Research question for this study is, what is the impact of the CCT or the 4Ps program, Pantawid Pamilyang Pilipino Program, on adolescent pregnancy and on health outcomes for adolescent mothers? We'll talk about the health outcomes here as the incidence of teenage pregnancy, antenatal visits, born alive, or the rate of children born alive, birth weight, and the postnatal checkup. And the objectives of this study are to determine the impact of 4Ps on adolescent pregnancy and on health outcomes for adolescent mothers in the Philippines using the data from the National Demographic Health Survey of 2013 and 2017, determine the demographic characteristics of teenage mothers, and recommend policies on addressing the issues of teenage pregnancy in the Philippines. Now, the impact of a poverty alleviation program like the 4Ps on adolescent pregnancy and the health of teenage mothers can be modeled using a theory of change framework, which describes how a program leads to changes in the short and long run. The figure below, the figure here shows that the 4Ps program, how the 4Ps program could lead to these short-term outcomes such as reduced incidence of teenage pregnancy and improvements in the health of mothers and children. Additionally, the 4Ps program allowed pregnant women to make more informed choices because they were given more information during family development sessions. So this information campaign can help other members of the family, especially teenagers, and eventually helps in reducing the incidence of the teenage pregnancy, and therefore the long-term impact would be health outcomes when they are older, which could be improved health outcomes when the child gets older. Now, we use this empirical model, the difference in difference method, wherein we estimated the Y here as your outcomes that I mentioned earlier. Example, the teenage pregnancy, the child health outcomes, and the maternal health outcomes, like antenatal checkups, postnatal checkups, and also in the child health outcomes would be the birth weight. And the regression, the model was regressed. So you have here the T would represent here as your time. That's 2013 and 2017. And the P would represent the post-treatment, and the pre-treatment. So you have the post and the pre-treatment. So over the time period 2013 and 2017. And we have the variables like the incidence of teenage pregnancy, as I mentioned earlier, and the child health outcomes and maternal health outcomes. And the variables or the covariates that were included were family characteristics and endowments that would affect the 4-piece program, such as the residence, educational attainment, gender of household, household size, the type of bathroom, and type of flooring, also to represent the assets or wealth. Okay, the data source, as I mentioned earlier, we used the Philippine National Demographic and Health Surveys for 2013 and 2017. In 2013, the 4-piece program expanded its coverage to almost all regions of the country, and that the NDHS 2013 database provided the best information available to capture the pre-treatment group. And given that the usual length of the 4-piece program is 5 years, so the 2017 database provided the nearest post-treatment information. So we also would like to determine the causal effect of 4-piece program for 2013 and 2017 households and individual datasets were merged for a total of 41,229 observations. And these two data sets were not longitudinal, so matching were necessary to reduce statistical bias. So for matching, we applied the coarsened exact matching, and we used household characteristics to get the estimates of correcting imbalances between control and treatment groups. And what we did was to compare or match the two data sets, the treatment and the control groups, and run the analysis to have the match, and the set thresholds for model independence and the causal effect estimation error through a specification. And moreover, this coarsened exact matching remains robust to measurement errors and is capable of balancing in sample nonlinearities and interactions. Now, here's the summary statistics after we have performed the coarsened exact matching on a time invariant characteristics such as birth year, ethnicity, age of first birth, birth order. And there were 33,175 observations. So out of that, we have for 2013, 14,295, and in 2017, 18,882. So I won't be going through the variables that we, the summary statistics of the variables. So these are all the outcomes or the dependent variables. And then we have the independent variables here, the summary statistics of the independent variables that we used in the difference in difference regression. Okay, now for the results. This table shows the effect of the conditional cash transfer program, the 4Ps, on incidence of teenage pregnancy using the standard DID model. And we have for base model with no controls, the model with rural controls, the model with wealth index controls, and the full model. So we estimated 4 models. The results show that although the incidence of teenage pregnancy decreased by around 1% point from 2013 to 2017 for these 3 models, no significant direct effect of the 4Ps program appeared to exist, a finding that was robust across all specifications. Now, a significant correlation existed in the household wealth index, and that's those in the richest category experienced 20 to 27% points fewer teenage pregnancies than did the poorest segment. Further, the education did indeed appear to lower the incidence of teenage pregnancy, as shown in this model here. And also, both the presence of a flush toilet and flooring in the household seemed to reduce the incidence of teenage pregnancy to some degree. We also noted some weak significant correlation to the gender of the household head. The presence of women heads of household may have reduced the incidence of teenage pregnancy by around 2% points. Okay. I apologize for the small fonts, but I will just read through the main or the most important results. So this table here reports the correlation of programs on children's birth weight. While there appears to be an increase in weight of around 75 to 80 grams between 2013 and 2017, the estimates were not significant. Infants born into the richest households, however, appeared to be 113 to 133.8 grams heavier at birth than those born into the poorest households. Moreover, we observe a weak significant correlation of tertiary education on increased birth weight. Now, this table reports the correlation of the 4Ps program on infant survival for adolescent mothers. Again, while there is a significant increase in infant survival of 6 to 7% points from 2013 to 2017 across all models, the difference in difference estimates were not significant. Education, however, did appear to have a positive effect, increasing infant survival by more than 10% points. Moreover, we observe a moderate significant negative correlation between infant survival and the number of household members and women household heads. Next, we show the relationship between 4Ps and expectant mothers' regular checkups during pregnancy. So as in previous results, a significant uptick in visits appears to have taken place between 2013 and 2017, though this did not seem to be attributable to the program alone because the estimates were not significant. Notably, a rural resident appeared to make significant fewer antenatal visits than those urban counterparts across the 3 models, these 3 models, 1, 2, and 3. Additionally, educational attainment was significantly correlated with antenatal visits, and the effect increased as did educational level. Tertiary graduates appear to have around 1.5 more visits over the base, which is no education. The number of household members seemed to negatively affect antenatal visits. And then the presence of a flush toilet appeared to significantly increase visits by 0.9. Now, in terms of attendance at postnatal checkups with 2 months after birth, again, 4Ps programs seem to have no significant impact, though rural residents seem to be some 5% points increase or less likely to have postnatal checkups within the specified time period. Moreover, the educational attainment appeared to have a positive significant relation of more than 16 percentage points on checkups. Again, based on as compared to the baseline of no education. Okay, now looking at the average marginal effects for each level of educational attainment for each group in the pretreatment period, the significant effects for beneficiaries were noted in the base model, implying that the probabilities that 4-piece program beneficiaries would have no education or primary education were 2.6 and 9.9% points lower, respectively, in comparison to the pretreatment period. Moreover, the marginal effects indicated that the predicted probabilities that beneficiaries would attain secondary and tertiary education were 6.7 and 5.8% points higher, respectively, than they were prior to subjects' enrollment in the conditional cash transfer programs. Now, finally, the full model, the last column here, including wealth indicators and other control variables, significant marginal effects were observed only in the secular trends, generally following the model with type of residence. Now, as for the conclusions, the health outcomes such as infant birth weight, infant survival rate, antenatal visits improved from the 2013 to 2017, and the incidence of teenage pregnancy declined. These improvements actually did not appear to be the direct result of the 4-piece program based on our difference in difference estimates. However, an increased standard of living as measured by the wealth index did appear to have significant correlation with decreased incidence of teenage pregnancy and increased antenatal visits, as well as the weaker correlation with increased infant birth weight and postnatal checkups. 4-piece program had a positive impact on higher levels of education for adolescent girls and decreased the incidence of teenage pregnancy, increased infant survival rate, and improved maternal health outcomes, or the antenatal and the postnatal checkups. The 4-piece program also seemed to affect the level of education of adolescent mothers positively and significantly, although the effect was moderate when we controlled for such factors as wealth and sanitary conditions. Though health outcomes and teenage pregnancy were not directly linked to the 4-piece program, higher levels of educational attainment and increased standard of living are seen as important factors that can lead to improved health and could avoid teenage pregnancy. Now, for policy recommendations, based on our results on education outcomes, we could recommend the following. The current 4-piece program grants financial support to students until they have completed senior high school. Aside from those financial grants, it would be worth considering to expand the 4-piece program to provide supplementary materials such as school supplies, uniforms, and footwear in order to strengthen the students' stay in school and perhaps to eventually take a college or vocational degree. That way, the parents would have very few or little costs for education. On the supply side, local and national government through the Department of Health and the Department of Education should continue strengthening infrastructure and staffing to improve delivery of quality education and healthcare to 4-piece beneficiaries. And also, since there's a positive impact on health outcomes for infants, especially birth weight, this underscores the importance of being mindful that the healthcare on infants that should be received during their first 1,000 days sets the foundation of improved quality of life in later years. Both prenatal and antenatal health care should be prioritized with a focus on ensuring a high compliance rate among beneficiaries, possibly by organizing and advertising health services more effectively. And we also have a program on first 1,000 days going on. Well, there are also other programs on nutrition interventions that the government could pursue or support and improve on that. So I think that would be all I have. Thank you very much for listening. If you have questions, we have our emails here. Thank you and have a good day.